Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their area and in their niches. Today, I have a special guest, Dr. Ritucci. Yes, Dr. Ritucci is a regenerative medicine doctor. You're probably wondering, what is that? Well, we're going to be talking about what is regenerative medicine and what it is and what it is not. You can find Dr. Ritucci at ritucciregen.com. That's right. That's rituccigen.com. That's RITUCCIREGEN.com. Thank you, Dr. Ritucci, for being here.
Thank you. And yeah, it's Ritucci Regenerative Med Doc.
Oh, that's so interesting. Hold on. We can redo that. That's the cool part. I'm not going to redo that. I'm going to stop that. You know what's weird is it says Ritucci, CIR, regen.com. Did I say that wrong?
RitucciRegenerativeMed.com.
You know, it
Hold
says
on.
regen.com. Okay.
All right, 1 second. Mama, let me call you back.
I could be wrong. Let me look.
Yeah, everything's good. All right. Yep. All right.
Okay, yeah. I think you might have another domain out there, by the way.
Might
That's the one I
yeah,
have. I'm looking right at it. Do you have another Ritucci after Ritucci? What is it?
Ritucci Regenerative
There.
Med.com.
Okay. 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 I see. You have two domain names, so that's cool. At least I know I had it correct, but halfway correct. Let's redo that, man. It's all good. Paste. I like to have it right in front of my face. I got it, man. That's key.
All right. I put it in the chat there.
I got it right here. I've got my little notepad, man. I'm on it. Okay, let me stop that because I want to have a clear. We'll go. I'll just start right here. I'm recording, so I can just chop it up. We'll have some fun. All right, here we go. Okay. Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niches. And the reason why we have the show, as you all know, we've been doing this for a while now. There's so much information that is out on the internet, everybody trusting Dr. Google, and people are looking for help. Well, we have Dr. Ritucci here. He's going to be speaking on what regenerative medicine is and what is not. As you know, there's a lot of talk about regenerative medicine. There's a lot of great things being said about it, and there's of course being bad things said about it. But forget about the bad things. We're going to be talking about the great things about regenerative medicine and how it's helping people. It's changing people's lives. Dr. Ritucci, you can find him at ritucciregen.com. ritucciregen.com. Thank you so much, Doctor, for being here.
Yeah, thanks for having me. I really appreciate the opportunity here.
Definitely. Tell us a little bit about yourself, how you got into being a doctor, and also about being board certified and what that means.
Sure. So, by nature, I'm a meathead. I'm a gym guy. Been working out for years. I was a national level power lifter in college. I got hurt. I went to physical therapy, went to chiropractors. I was a patient myself. I started out as a fitness trainer with an exercise science degree. So I was training people, but people would always complain about injuries and pain. And I found myself limited to what I could do for them as a trainer. So people seem to seek my advice on those types of things. So then I went to get further educated and ended up ultimately going the med school route because I wanted to learn everything there was about nutrition and science and chemistry. And I was young enough and fortunate enough to do that. So I did it, and it took a long time, but here I am, 25 years later. And I got into regenerative medicine about 16 years ago. Actually, talking to a fellow med student during a break from a lecture, he was talking about PRP and how athletes do it and how it helps like long-term changes in the tendon and ligament. And prolotherapy was big at that time. And I was learning about that. So that's where my origins started. And I'm a physiatrist, so I do a lot of musculoskeletal, non-surgical orthopedics. So, our training is, we really do cortisone and gel shots, things like that, and then refer to surgery. But I was like, well, what about regenerative medicine? And, it's not covered by insurance. So, not a lot of hospital systems are in with it. A lot of private clinics in Florida, but then there was a company I worked for, QC Kinetics. They did get me I got my start with them. I was able to I was learn from them and learn what they do and how they do their, how they prepare their orthobiologics, and learned how to perform the bone marrow aspiration, which is the stem cell procedure. I did so many of them with QC, a lot of high volume, and eventually I wanted to put my own twist on it. I opened my own practice. So I've introduced Shockwave to my practice, and I also do some conventional, insurance based medicine for those who are still not ready to do regenerative. But the people that do regenerative, over 90% of them are happy with the results, and I'm happy to see that, and to see that it really works. I actually do shockwave on myself, on my own back and my thumb, and my
Well, let's
shoulder.
talk about that. You brought up shockwave twice now. We got to talk about it. What is shockwave? I know it's regenerative medicine. It's all connected. Tell us about this shockwave thing, because you're telling me that people are coming in, they're just testing it, and when they test it, they're like, okay, I need to get on this.
Yeah, right. So yeah, shockwave, there's two types of shockwave. There's the radial shockwave and the focused shockwave. I have the focused shockwave because it penetrates deeper into the joint. So I do a lot of arthritis management. So with that comes, hip, big joints, deep joints, the hamstring attachment and the buttock. There's a lot of beef there to get to. So the focus shockwave penetrates deeper. So I went with the focus. It's more expensive. The both shockwaves were the radial's a little bit. It's more superficial. It's kind of like a shotgun. It spreads out. It comes
Hmm.
out very intense from the headpiece and then dissipates. Doesn't go very deep, but it spreads out nice and wide. It's good for like myofascial pain in the back, like if you have pain on your whole back and stuff. A lot of chiros use it, PTs use it. It's a great tool. The focus device is, as I said before, it penetrates more deeply and deep into joints. What does it actually do? Well, the shock wave is produced by electromagnetic forces, at least in my machine. Electromagnetic force produces a physical shock wave that comes out of the headpiece here. And the shock wave, with the help of some gel that you put on the skin, conducts through the skin deep into the tissues. And what it does is it awakens, injured cells by hitting the receptors on those cells and causing cellular processes of regeneration. So this is called mechanotransduction. Transduction, by definition, if we want to get nerdy in cell biology, is basically a cell has a receptor on it, and a lot of times other cells signal a molecule to that receptor, and then the receptor is like a program, like a button that you push that does a certain thing in the cell to produce a protein or to produce something else. But it can also be done with a physical force, not just a chemical, signaling molecule from another cell, but an actual force from the shock wave can actually press those buttons, those receptors as well. And that's what shock wave does. And the way that it's regenerative is it helps the processes of creating blood vessels. It's called angiogenesis, where basically more blood vessels are created in the injured tissue to help channel blood flow to the area, to help it regenerate itself, to help heal itself, essentially. Very non-invasive. It hurts, not gonna lie. It's not very comfortable. It doesn't hurt everywhere. It only hurts where your problem is, typically. When you're over that arthritic side of your joint, you feel it a lot more than if you're over on the other side that doesn't have arthritis. But, it's like I said, not comfortable, but people say it hurts so good. Like,
Like John Cougar Mellencamp.
right, right. Exactly. Hurts so good.
Hey, sometimes love don't feel like it should. It's interesting. You're talking about this, and correct me if I'm wrong. So what I hear you saying is, let's say these five fingers are stem cells that are dormant, and the dormant is standing for inflammation now. Now it's inflamed. We'll say it's around the knee. But when you utilize shockwave, what it does is it starts to awaken those dormant cells that were inflamed, and they start to kind of become more alive, which starts to take away the pain. Is that correct, or is that am I kind of close?
Generally correct, yes.
Okay.
The shockwave mainly, it may help, some local stem cells in the area, but it's mostly targeting injured cells, in injured tissue. Not
Mhm.
necessarily stem cells, but helping
They're your own. They're
inflammation.
your own cells. They're your
They're
own.
your own
Right.
cells, right. Stem cells a little bit different, slightly different conversation,
Right.
but, PRP is not PRP is an injection. When we take your blood and then we spin it from whole blood, which consists of red blood cell, white blood cell, platelets, plasma. We get it all of the stuff out that we don't want, and we just put the platelets, which we want. Then we inject the platelets into the injured joint. What the PRP can do is, let's say your knee, for instance. If we inject PRP into your knee, you have some stem cells in your knee, not a lot, but you have some that are dormant or that are not doing what, they're just stem cells, the baby cells that need to be told what to become. And the
Mhm.
PRP can help activate those cells. But the PRP also works on blocking, inflammatory cytokines. Cytokines are basically molecules, chemicals that are like causing inflammation and pain and are driving the process of arthritis.
Mhm.
Things like interleukin 1 and tumor necrosis factor alpha, those are like the bad cytokines, and PRP helps block those and block the formation of those. So it helps with pain management, and that's why people feel less pain with PRP in the long term. Stem cells, if you're doing stem cells, that's a little bit more nuanced, but the stem cells that I do are the bone marrow derived, which basically we take stem cells from your bone marrow, which is in the back of your pelvis on either side, the bony prominence, the dimple that
Mhm. The
sticks out
dimple.
on people's back side.
Mhm.
Usually, we numb it really good with lidocaine, and then we switch the needle at that point. The patient doesn't really feel much other than some pressure, and then maybe some. Once we set the needle where we need it to, we just aspirate. We pull the plunger, and it will like vacuum out the bone marrow. It looks like blood, essentially.
You
Uh,
you pull a plunger.
Pull the plunger. Yep.
You got
Yep.
to pull that
Suck it
plunger,
out.
man.
Just suck it out and
Mhm.
pull the plunger, and then put it in the machine. Get it into the stem cell rich layer, and then we push the trigger. We inject the stem cells into the joint. That has a lot more ability to actually release a lot more stem cells in the area and actually become cartilage and tendon and ligament cells, and ultimately cause a lot more profound regenerative effect. And
Now that would be called regenerative medicine. So we
all
were
of those
since we're
things would be,
right.
yeah,
This is
yeah.
all regen, and regen means it's to regenerate, to
Yes,
make
all that
alive
I've
again.
talked about, the shockwave, the PRP, and the bone marrow, stem cells, all are considered regenerative, medicine. Regenerative medicine is an umbrella term, which basically helps the body heal using methods to help the body heal itself, from, injury that has failed to heal itself due to injury or lack of blood flow or just other factors. And yeah, there's multiple methods, from more affordable to more expensive,
Right.
depending on how
So
the
you can
program.
kind of do baby steps, make work your time up, kind of go at your own budget and work your way up. Because once they start to see, hey, this is starting to work. Hey, let me try this to get to another level. Is that what I kind
Right,
of hear? Yeah. So
right.
you work with people's budgets.
Some people go carte blanche like right away, and
You know, give me the Ferrari.
yeah, they just go right for the Ferrari, and sometimes, if they don't respond, they have buyer's remorse or whatever. But I like to kind of ease them in if they're not sure, because a lot of people aren't sure about regenerative. You know what I mean? Regenerative medicine is new for the most part. Hello, 30 or 40 years old. And really, for the last 10 years, has been mainstream. Becoming a little bit more mainstream.
Especially shockwave.
Yeah, and the
I
shockwave.
mean, that's I mean, just to throw this out there, everybody out there, I will let you know I tried Shockwave. So I
Mhm.
had this real bad pinch in my back. I mean, it was just pain. It would get numb, whenever I'd play a sport. And I'm a sports guy. I'm an ex tennis pro. So,
Nice.
I was just like, this is killing me. And I was talking to a friend who does regenerative medicine out in Mississippi, Tupelo, Mississippi. You don't want to go there. Anyways, I don't recommend it. Can't find a good cup of coffee. So,
Oh, that's
yeah, it's horrible. So, guys, so I tried it, and he was doing it on my back. I'm not joking. Within 4 or 5 minutes, pain was gone. I mean, from my pain level was about an 8.5. It went exactly to a zero.
wow.
Everyone's different, but what I will say, it works. I endorse it, and I always tell everybody, if I knew what I knew now, connecting with you doctors, I would be a doctor, because I love the toys. I call them toys. The toys that you have. I mean, you guys have. I mean, with stem cells, you can regenerate bones. Like people, it's funny. I'll talk to some doctors like, well, there's no such thing as the bone will be regenerated. And I go, well, it's because you went to one of those big box doctors where you just signed the contract. I'm bad.
Right.
Hey, I could say it. I don't have a doctor's degree, you know, and that's okay because they come in wanting to help, but that's what they do. They do surgery and there's a time for surgery. But if we can do non-invasive and everyone out there, there's a lot of people that the doctors have told you that you're bone on bone.
Yeah.
And please correct me if I'm wrong, Dr. Steven. And sometimes they'll say you're bone on bone, but you're not. Get a second and third opinion. And before you do surgery, find somebody like Dr. Ritucci that can say, hey, this is what I recommend. And sometimes I'm sure you're going to say, hey, you're going to need surgery.
Yeah, yeah, I definitely when the surgery is warranted, I'll recommend it, and,
Hmm.
a lot of the people I see are in the gray zone that are like, they've already tried the conventional stuff, and, a lot of people come to me because they just don't wanna do surgery under any circumstance, whether they need it or not, and, I've had people that are yeah, like bone on bone. What does bone on bone mean exactly? Well, bone on bone means exactly what it sounds like, except the thing about that is, you could be bone on bone in one part of the joint, but not bone on another. And for instance, I have a knee model that I can show you. So this is the knee model here.
Hmm.
Okay, so you could be bone on this side, but not on this side. Like you might be up a little bit more, and so yeah, you're bone on one compartment, or between the kneecap and the thigh bone, you could be bone on bone there, but not bone on bone here or there. So if you're bone on bone in all areas, then you might have some, and you have symptoms and pain, then there might I might still be able to help with pain. Like you might still, the PRP might be able to block the cytokines, the inflammatory cytokines enough to help with pain, but probably won't regenerate any tissue per se. I probably wouldn't recommend a bone marrow, injection for that patient. But if they just wanted some pain relief, PRP is perfectly reasonable. So even, and PRP has been shown to be superior to cortisone for knee arthritis, even severe knee arthritis, like the worst type, which we
Hmm.
call the Kelligan-Lawrence scale number 4. 1, 2, 3, 4.
Hmm.
1 is the not as bad, 4 is the worst. And even people with like stage 4 got pain relief with PRP. So yeah, I mean, there's degrees of how much it can help. But yeah, generally, people that are not so far gone, people that are being told they need a knee replacement in about 10 years or something, and you could suffer until that, there's nothing I can do until then, but that's the type of person that I see typically.
Well, let's go a little bit deeper on this. Like, there's a reason why you got into this. I remember before we started talking on the show, you were telling me about how you were a power lifter and you started going through some pain, and maybe if you can kind of tell us about that. And then from there, let's go into some of the testimonials of things that you've seen happen in your practice that you're just like, wow, this is amazing.
Sure, yeah. So basically, I mean, I'm a patient just like all of you. Chronic problems, and I've got chronic back problems, chronic shoulder issues. My thumb is messed up from a power clean injury. when I was in college. I've had issues with, I've been lucky with like knock on wood, but I messed my ankle up really bad. And all these things still hurt me to this day. And I don't like how things persist and pain persists. And this is basically, exactly, you sprain your ankle and it heals and you're good to go. For me, it's always been it's injured, but it's never been the same. And I feel for people like that because I am that person. And unfortunately, I can't inject myself in some of the areas, but I can shockwave myself. And I can give an example of myself. Shockwaving my back. I have to do this with my, and boom, 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 like that. And I have to say, I did 2 sessions of it, like spaced by a week, and that my pain is greatly lessened. And I'm still deadlifting in the 500 range at,
500.
almost 48
Wow.
years old. Yeah, and even with a bad,
You got that old man muscle.
yeah, old man strength,
Old
right?
man straight good there. Yeah.
But yeah, I was like having pain carrying my child, in the front before I was doing that shockwave. I do the shockwave and now I can carry him around again. So that's an example of how it can help even the chronic, pain. And that was bothering me for about 4 or 5 months where I couldn't carry my child because of increased pain in my back. And then as far as testimonials of patients, I mean, there's many people that have done great and have canceled surgeries. I can think of two right off the bat that I had one 68-year-old gentleman that came in with hip arthritis. He was facing a hip replacement. He he basically had it scheduled for about 5 months. This was last summer. I worked with him about this time last summer, did a couple PRPs of bone marrow on him. I didn't have the shockwave yet, but, by November, he canceled his surgery. He came in to tell me that, and he said he was traveling the world with his fiancée, and again,
Did you get a video testimonial?
I should've, but,
Yeah, we'll work on that.
yeah, yeah. He said he didn't
Right.
look his best that day, so he didn't wanna,
All right.
but anyway, that was him, and then I had another gentleman who was, like, scheduled for a show like, a rotator cuff repair, and then he on a whim, he had signed up for other joints, like, when I was at QC, and he, he was doing, like, his neck and his knee, and then he's like but he was getting shoulder surgery, and he's like at the last minute, he's like, "I wanna try my shoulder, and then if it works well, I'm just gonna cancel my surgery." And then we did a PRP and an A2M and a bone marrow on his
Well,
shoulder,
you went for it.
and he canceled the surgery, and I saw him recently for another joint, last month, he came to see me, and, his shoulder's still doing better, he's still doing great, so it wasn't, at the 1-year mark, he's doing really good, so that was
Wow.
reassuring, to see that. And I mean, I have a handful of other people that are doing great that were hobbling when they came in, and they're running, 3 miles in their late 60s. I have an ex-Marine that's, he came about 2 years ago having a lot of pain in his knee, and we did a combination of things, bone marrow. We did PRP. We did a lot of shockwave on him. He's running 3 miles every other day, like he was in the military still, and, he has no
I mean,
pain, which
I
is
mean,
ama
these are testimonials that you cannot keep quiet. And I'm sure that when you have somebody that's been healed, that word of mouth spreads. I mean, you probably have a lot of word of mouth of people coming in because of things like that.
Yeah, yeah, I would say
I
that
mean, you
most.
can't keep quiet.
No, no, I don't ask for testimonials, like, just to have them, because I know a lot of people do, like, just whatever, some people fake testimonials. I know of some people that, just to have them, just so that it looks good for the business. I try to get more organic testimonials,
Exactly.
and I have a handful of them, but I do have a lot of people that, they haven't left a testimonial, but I know that they did really well. They know that they did really well, and eventually there'll be a lot more testimonials
Right.
to see. Yeah,
It's like the movie. I know that you know that.
right.
Anyways, or okay, you know that I know.
Yeah,
but
exactly.
but it's cool because we have this technology that at first it was kind of hush hush. And now I think people are seeing how the world's changed so quickly. I mean, just even with AI, with what it's doing, how it's helping, how it's not helping. There's this negative, there's this positive. But where do you see regenerative medicine going? Even say with stem cells in the next and PRP in the next, say, 5 years.
I would say it's going in a really positive direction. I know that a lot more people are going to be doing it. It's going to be more mainstream. It's already being some PRP is being covered by the VA in some cases. I've had some people get it covered by the VA system. So
Mhm.
it's starting to they're starting to recognize it. And as far as stem cells, they've let the FDA has been, kind of like cracking down on stuff a lot more back in like 2013, 2015.
Mhm.
There's other stem cells like not from you, like from umbilical cord and from like Wharton's jelly, the placenta, and those, are a little bit less regulated. You don't really know how they're prepared, but theoretically they could work even better because they're young cells and they might be an option for people that have had, prostate radiation and their bone marrow is defunct, or they've had maybe a bone marrow issue. It might be a great option for them, for older people, people in their 70s, 80s, 90s. And I see an increasing amount of clinics that are now offering that, intravenous stem cell. I mean, stem cell can not only treat arthritis, but can treat all kinds of things like heart disease, wounds. I believe there's also stem cells that are covered by Medicare for wound care.
Yeah.
I
Yeah.
overheard.
Wound care. Yeah.
Yeah, so it's definitely going in the positive direction.
Mhm.
It's the red tape, man. It's just like there's a lot of people are gonna, like, lose business. A lot of, I hate to say it, but a lot of, big pharma's not gonna they're gonna lose out a little bit because
Yeah, I don't think it's gonna hurt them though.
no, I mean, they've got a big enough armor on them
I'm
that it's
throwing a little sarcasm out there.
they'll probably, like, survive, but, not as many people will be on pain meds, not as many people will be getting joint replacements. So there's a lot of, hold up on the administrative end, and, I'm not a politician by any means, and I don't claim to be, but I know that there's a lot of it's politics and red tape, which is why it's preventing it, I guess, from becoming mainstream quicker. Now, if I were you, I wouldn't wait, too long. I wouldn't wait for them to approve it if you've got the extra cash and you might they might approve it in 20 years and you want to wait 20 years to it's a very, it's an investment that can be, financed, and it's definitely if you're the type of person that's willing to invest in your health, it's worth it. Very safe to do. It's really what have you got to lose? Like if the insurance-based treatments are failing you, you know, what are you
You're
gonna do?
definitely
Get more insurance-based treatments? I mean, if there are things out there that are not insurance-based but are better, I mean, wouldn't you do it? Like, what,
but you're
don't
actually
get
saving
Botox.
money. I mean, you're actually and
You're saving money and, you're also, like, giving quality of life to yourself. I mean, yeah, the worst case scenario is it doesn't work. I mean, it's not gonna, like, put you in a catastrophic state any worse than you are now, most likely. I mean, if you have it if you're just waiting for, to get surgery or whatever, and you feel like that's the only option, and, this is definitely a great thing to try if you haven't already.
you know what's interesting is I remember when Joe Rogan had Mel Gibson on a show
Mhm.
and his father was about to die, and they're like, "He's done," and he heard about stem cells, but at the time, you weren't able to do it in the United States, and I think they flew some to some third world country, I don't know,
Yeah, yeah,
Nicaragua or
yeah,
something like
Mars,
I
yeah.
don't know, but they actually it was Panama. It was Panama.
Ye
He
yeah.
flew out to Panama, and I think his dad was like, I don't know, like 75 at the time, and they're like, "Look, he lived his life," and he goes, "No, I wanna try this," and I think that was like maybe 15 years ago, but now they're saying his dad's still alive. I'm like, what the heck? From the stem cells. So literally saved his life, and that show blew up stem cells. And then they said, okay, well, stem cells is getting too much coverage. And that was what I think it was like 7 years ago. And You couldn't use the word stem cell. You had to say mesenchymal cells. You
Yeah, yeah,
know,
cell
there,
theory.
yeah, we had to get all creative. Cellular cell or whatever.
Yeah, you know,
But
stupid.
it's changing. It's changing people's lives, and people don't realize that if you do like surgery on your knee surgery, it's going to cost you $50,000 to $70,000 depending on what type of surgery. I mean, with stem cells, I mean, it's not even, I don't know how much it is over there, but I know that you can get stem cells, say it's a knee injection between, I don't know, 4 and 7 grand, depending your area where you live. I don't know.
Yeah, yeah. I mean, it's substantially less than 70 grand for sure, like, and it's like, you don't have any downtime either, which is the nice, when you get a knee replacement, you're out of work for, 2 to 3 months, you can't bend your knee a certain way, you gotta do rehab, so that costs money. Insurance usually doesn't cover everything, you're gonna be responsible for something, and, like, the lost time from work, and the lost time from golf, and the lost time from pickleball, and, all those things that you might have been able to do, doing this as opposed to surgery. But
No,
but it
definitely. You mentioned pickleball.
Yeah,
That's I play like 4 days a week.
must be all over that since you're a tennis pro, that must be easy for you.
It's pros and cons. It's a different game, very different game. You got to people don't realize that when you have a ball, that's a rubber ball. Now you're playing with a plastic ball, heavier. You do have some advantages, playing memory, the way you play on the court. But in tennis, you want to slam. In pickleball, you want to finesse and very few times slam. But the reason why I bring up pickleball is because it's not only the new surge, but there's a lot of people that come in with pickleball elbow, and they have that pain. And I always tell my doctors, if you want to get more patients, go play pickleball on a Saturday morning. Get to know the people. 95% of them are something wrong with their knee or their pickleball arm.
Oh, yeah.
No, seriously, it's just
Pickleball,
like
lot of injuries from pickleball, that's surprisingly, it
no, and they don't want to go to the doctor, but if because they think, oh, I'm just getting old, instead of thinking that you can be healed of that. If you had
oh,
somebody with pickleball, would you throw a shockwave on there?
yeah, I mean, depends on how serious, if it was a really bad injury, we'd have to do some workup, but, yeah, if it's just like tendinitis, or their knee is bothering them, their elbow's bothering them, back's bothering them or whatever, yeah, a lot of people come in and do some shockwave and or PRP or something, and, because PRP is great for tendon problems and, especially leukocyte-rich PRP, which is
Mm.
it's a little bit of a scientific conversation, but yeah, the leukocyte-rich PRP is really good for tendons and ligaments, like tennis elbow, like Achilles. Achilles is another one. Achilles is a huge
Mm,
pickleball, right? You sound like you know. You know,
yeah,
it
it is. It is.
it's a large tendon that, is basically the conglomeration of the multiple calf muscles that come
It'll
into.
stop your whole game.
Oh, yeah, that's why they call
Dismantle
it Achilles heel, right?
it, Lord.
It's where you go on your toe, you step off, you push off with it. I mean, it's when it's injured, it can really be debilitating and, but yeah, the PRP and the shockwave can do wonders on that. I had one guy that came in, another guy in his mid-60s did it for his Achilles, and he did like 7 or 8 shockwave treatments, and he was feeling really good, and he was feeling better every time, so and again, older guy, he's in the construction
Mhm.
business. So, yeah,
Well,
a lot of
you
people
did
doing
you,
it.
you did physical therapy, is that right? You were a physical therapist, or you worked in that arena?
I
How
was
did
a
that work?
personal trainer, I was a strength coach, and I have a degree in exercise science, but I was in
Hmm.
physical therapy for a lot of joint issues.
Right.
Like, I
Okay.
did it for my shoulder a bunch of times, I did it for my elbow, I did it for my back, I did it for my knee, I did it for my ankle, I've you know, I've I know
You
a
were the
lot about
patient. You were the patient.
right, I've been a patient for a lot of physical therapy protocols, but I was never technically a physical therapist, yeah.
Well,
Yeah,
that's
same
good
with
because you
chiropractor.
you know how to help people with that. What I'm
Yeah.
saying.
Oh, yeah. And a chiropractor-wise, I also had a lot of chiropractor visits, and chiropractors are great because they do a lot of hands-on and the manipulation. So I'm a DO, which MD and DO are pretty much the same, except DOs learn some of that stuff and can incorporate it into their
Mm,
practice. We learn it in
mix it.
medical school. It's called osteopathic manipulative treatment, OMT. And a lot of DOs don't really do it. They just, they don't. It's like it takes practice, and like if you don't go into like a musculoskeletal practice of any type, usually you don't end up doing it. But I still do it on people. It involves like doing like kind of stretching techniques, massaging techniques, and also manipulation similar to what a chiropractor does. I'm not a chiropractor per se. Chiropractors are like kind of the masters of the minute, they have all like they're like the Jedis when it comes to doing manipulation.
So true.
But I can do some basic, moves if needed. And but it's not chiropractic. But I mean I know enough about chiropractic by being a patient as well as being a DO. So if you marry the PT, the chiropractic, exercise, and regenerative medicine, it's like you can keep going. As you can be a Formula
You're
One race.
Jedi.
Exactly.
You might be a Jedi. You might be a wild Jedi.
Yeah. Right. Right. A wild Jedi, but a Jedi who can still swing the lightsaber. In his
No,
seven.
exactly. And then you got to wait till Yoda comes in. But anyways, we're all
Right.
speaking Star Wars terms. But yeah, I tell you, Disney, I'm not going to go there. So yeah, that's another
Right.
story. It's like, dude, why'd you ruin it? Anyways,
Agreed.
but yeah, I'm like, yeah, unbelievable. But are there any specials that you're running currently in your clinic right now? And if so, how does that look? And if somebody wants to find you, where can they find you? Tell us about the area that you're at and stuff like that.
Sure. Yeah. So I have one special running that because a lot of times I'll get people's insurance, and have the consultation and any office visits billed through insurance like any specialist. So it saves you the out of pocket cost, plus minus your copay or deductible. But if you don't want to wait to get, approved by the insurance, or, a referral from your primary, or let's say you don't have insurance or you don't want to go through the headache, I charge $250 for the consultation plus a shockwave treatment of two
Good.
joints, So that's I think it's a very fair, deal. And generally speaking, I do an assessment, and I do an ultrasound diagnosis, and we kind of go from there to see if you're even a candidate for. But I still offer the shockwave to eligible joints. If you have an infection over the joint, for instance, I can't do the shockwave, but I can do it somewhere else. Or I'm sure you have more than one area that's hurting if you're coming to
Yeah.
me usually.
You're all something.
Right.
If not, let me hit you in there. Okay, now you got a little plan.
Right, but I have a lot of people that come to me, they say, "Oh, this hurts, and I actually have this thing hurts, oh, and I wanna address my knee at some point, and my" so but, and generally speaking, you can find me in multiple places, you know, my website is, as you said before,
Hmm.
www.ritucciregenerativemed.com. That's my website. You can find me on Instagram and Facebook, Ritucci Regenerative Med. Pretty easy, same thing. And, I am located in Norwood, Massachusetts, on the Boston Providence Highway on the, Route 1, as they call it, centrally located. The address is 115 Norwood Park South, Suite 208, Norwood, Mass. 02062. And, you can call us at 508-722-0455. And you'll get one of my assistants. They can assist you in with any questions you have. And if there is a lot of questions about regenerative, I can also chime in and take a call if you have more detailed questions, or maybe you've done regenerative medicine, some of it, or you haven't done all of it, or you're looking to do it again or something. I can always talk on the phone, for a few minutes with no charge. So I'm pretty flexible.
Awesome. Awesome. I love it. So it's a Reducci. So
That's right.
so really quick, yeah, no, I want some spaghetti now. Now I'm craving some lasagna or something.
So am
Uh
I. Right.
I'll take a meatball. But yeah, so with that being said, you said the special is what, 200, 250 for the
250 for a full consultation and a free shot, a shockwave treatment of 2 joint, 1 to 2 joints,
how long
which,
does that consultation take?
about an hour and 10 minutes.
All right. Okay. Okay.
Mhm.
Awesome. So I want to lead off with that or end off with that. Everyone, I want to let you guys know when you go see a doctor, you're going to see it. When you see a doctor, you're going to see him for about 10, 15 minutes. Pat you on the back, go take a couple aspirin, whatever it may be. And maybe you need that. But I want you guys to really pay attention here. You're only paying $250, right? But you're getting an hour consultation. Why? Because he's looking at the full body. That's huge from top to bottom. Not just that, but just going in there just for the charge, just for the shockwave is worth it. I mean, I'm one of the guys. I've used it. It works unbelievable. To be honest with you, I wish I could afford a shockwave machine just for myself and for my family. I mean, it just works. I mean, that's what it should be called. It's kind of like Nike, the slogan. It's just do it. Shockwave. It just
Yeah.
works. Actually, that you can coin that. That would
That's
be
right.
anyways. So I'm encouraging you all, guys, go check out Dr. Ritucci. And I'm just going to let you know I'm not speaking for him or this way, but it works. Shockwave works. If you struggle with, say, neuropathy, and you're like, dude, I can't get this pain, you'll feel better. And not just that, the consultation itself, unbelievable. Anyways, I almost feel like I want to go see you. But thank you so much, Dr. Ritucci, for being here. And I look forward to getting to know you and possibly having you on the show again.
Yeah, Mark, thanks a lot for having me, and, appreciate it.
It's a Ritucci.
That's right. That's all right.